All righty. This is episode 2 of the Autonomic Dudes with I'm Dr. Rob Wilson and my trusted dear colleague and friend Kyle Shannon, APRN. And the reason why we're doing this is really just two really colleagues and friends conversations on autonomic issues to help medical providers, patients, and their support people. Right, Kyle?
Yeah, that's right. I think we wanted the first episode to kind of be a brief episode, kind of talking about what is POTS. But as we kind of go through this journey, looking into autonomic disorders, we want it to be educational. We want people to be able to listen to, and also see us on all of our different channels, to be able to understand and go through, what is an autonomic disorder? What are we looking for? What could be potential etiologies of it? And trying to get to the nitty gritty, getting just past the basics and actually getting into the ins and outs of the disorders and what we can try to do to help people. So yeah,
Got it.
absolutely.
And we actually have our inspiration who's been working with us, Nick, who's going to co-lead. Nick's was summer 2, brave soul to come back with us year 2. So Nick, you want to introduce yourself and get us going? We're going to discuss causes.
Yeah, for sure. They're too nice to me. It's just my second summer here. I'm a second year at OSU. Having a great time here starting this podcast. Today we are planning on talking about the causes of POTS. Like last time we talked about what is POTS, I think it's important for us to talk about as well what is the causes of it to try and educate you guys.
Yeah, exactly. So really causes of POTS. I think the last episode we talked about what is POTS, and I think somewhere both of us talked about patients still, even though we might not know the exact cause for patients, don't miss the opportunity to treat your cause. Because sometimes we don't know about the cause. And Nick, you've been with us, right? Where some of the patients we diagnose and we don't know yet the cause. And it's sort of a journey. I always say it's an experience the first time, taking all of the patient, and we don't know where it might all go, right?
Yeah, definitely. I see for a lot of the patients, especially, it's really unfortunate because a lot of them just see that their symptoms out of nowhere, and it just kind of derails their lives. And it always makes me feel really sad to see that, because some people like lead very active, very engaging lives, and then all of a sudden they can't do the things that they used to want to do before.
Well said.
Yeah. And then I think, you're right, Nick, you make a good point. Sometimes you take a totally normal individual with no chronic illness, no health issues, and it's like someone turned the light switch, and it suddenly went from days are bright to days are dark.
Yeah.
And and everyone's always wondering, well, why? And Rob already alluded to this. It's a difficult question. It's actually probably one of the biggest questions that I don't like asked of me when I see a patient, because it is Dr. Wilson, as Rob already alluded to, it's not an easy answer. It's not clear as day in a lot of the cases. There's some where there's a preceding event where it's very simple. It's easy to say, oh, this happened a week later, now everything happened. That's not the case in a lot of these stories. I'm sure I know Dr. Rob, you would say that, and Nick, I think with your time, you would probably feel the same way.
Yeah, exactly. Yeah.
Sorry, it's not exactly a clear answer, and we try and help them as best as we can by treating like POTS directly. And if we do know if we do know what caused it, it actually changes it a lot. So I want to ask you guys, first and foremost, why do the causes of POTS matter?
Well, I could jump in there a little is because sometimes there's some very important root causes that can be managed, that can improve the POTS, and might be a window to other health conditions that can be remedied, and to other conditions in the body can be associated. I think Kyle made a very good point. Probably globally now, and maybe in the United States, COVID is still probably now the biggest cause of POTS. And it's very clear you have a person, I was fine, had no health issues, though we published this data that a lot of the patients who get COVID and they get POTS from COVID, a lot of them had something else neurologically before, like migraines, irritable bowel, fibromyalgia, interstitial
Hyperexcitable state.
Yeah, there's other neurological systems that were reactive systems. Nervous systems usually function in a state of quiet, but this sort of COVID inflammatory state, not disabling COVID, no ventilator, no hospitalization, with this prior neural condition catalyzed into another POTS reactive state. That's very clear to know, but you want to know because there might be things relevant to its causes that might be sort of aspects to the health condition. Kyle, do you want to add into that?
Yeah, I mean, I think, you've used analogies before. I tend to use the same one. A lot of times for patients, it's like you take a beautiful home, right? And you can have a house fire in the home. That house fire isn't always seen, in the kitchen. You get a kitchen fire, a lot of smoke damage. You look at it's like our patients, right? You look at the patient from the outside, they look fine. You see them in the waiting room, you see them in public, you see them sitting in your office in the chair, and you say, wow, this is a healthy looking individual. But what we can't measure is what was that smoke damage
Yes.
that like it's similar to the house. When you have a house fire, you can't see all the damage that smoke did to the walls and to the interior, but the exterior looks fine, and that's what we're looking for, right? We're looking for what was that fire, if it's still active, or what was the smoke damage from whatever that underlying condition is. And I mean, we ask very detailed questions. Sometimes patients think we're asking odd questions of them, asking about dryness, asking about bowel
Yes.
habits, asking about all these
Yes.
things. I know we're going to get into this, but there's a pointed reason why we're asking about this, because we're trying to look into underlying etiology. So just always keep in mind, when you're talking to a patient, they may look fine, but there may be that underlying thing that's more in the interior, if you will, that's causing them to feel the way they feel.
Well, I'm going to jump into that a little more because I think that smoke analogy, everyone uses a cell phone. The body's like a cell phone. It's all about neural circuits. It might look good, but not work. Just like a cell phone might look good, not work. But I think you're right. People remember this time where their health changed, and they might forget things in the remote past when that fire happened. A good example of causes, like Nick and Kyle, we talk about is concussion. People might remember, oh, I had a concussion a year prior. And that might be the catalyst or catalyzes that trigger for the POTS, because a lot of the blood pressure and heart rate centers in the brain, and that might lead to that wiring change that leads to blood pressure and heart rate dysregulation. That often causes that sort of high heart rate, high blood pressure POTS, that hyperadrenaline POTS we talk about sometimes. But you want to know that concussion is a cause, because there could be other things that we see associated with concussion long term: sleep disorders, changes in mood, headaches, personality changes, cognitive disorders. You want to be able to classify for a person, because often people are sort of with the POTS, it might be part of something else that needs to be rendered and identified. Just like, when you buy a house, you find some water damage, the more you start looking for, there's more things going on besides that leak in that one ceiling area, that level.
Yep.
Yeah,
Yeah, and I definitely, if I can jump in really quickly, I definitely
sure.
find
Jump
something
in.
I definitely find something that's really useful to me personally to try and understand the patient while I'm shadowing like Dr. Wilson or something. It's very useful to me to try and understand what they are personally going through, like their reality, because we each have our own reality, we each have our own senses. And what I try to understand, like, for example, what does your brain fog feel like to you? And what does your pain feel like to you? And I find it to be very indicative of inner processes that are going on.
You're
That's just,
right. You're right. You're right. I mean, what's dizziness? I don't know what dizziness is unless someone tells me what their dizziness is. Is the
yeah,
room spinning, you spinning, the room spinning, everything spinning, or lightheaded? We don't know what that means. You're right. What is that experience?
it's very unique to each person, definitely.
Yeah.
And it's
Yeah. So
very
let's
useful to
talk
understand.
causes for the time we have. I mean, concussion's a big cause. COVID's probably the biggest cause. Kyle, anything else you would say is a big cause?
Yeah, so I think whenever you think about neurologic cause, right, you look into neuropathies. So exam matters. When we think about neuropathy, right, numbness, tingling, paresthesias, it's a different experience. Some people it can be painful, non-painful, but neuropathy, specifically with the autonomic neuropathy, that can actually lead to difficulty regulating blood pressure and heart rate. And you can see that, and there's some certain conditions that you can see lead to autonomic neuropathy. Top two in mind would be diabetes, Sjogren's. Rob, you've done a lot of
Mhm.
work with Sjogren's
Yes.
neuropathy. I think your data from some of the research you've done shows that, what is it, 15 to 20% of POTS patients may have Sjogren's as an underlying condition. I don't know if that data has been changed, but that
No,
was
that's
at
about
least
right.
it was about 5 to 6 years ago. I think that's what your data had showed. But I mean, those are the things I think of. And that's why, when you hear us asking about in visits, you'll often hear people when we're talking, what do you have dryness, dry eye, dry mouth, dry skin?
Yeah.
It's because we think of that underlying, we're thinking in our head, could this individual have an autoimmune etiology such as Sjogren's?
Yeah, and one of the challenging things is we do know this. We did some research with this, and that you know some of the testing with skin or biopsy, the blood testing led to confirmatory Sjogren, especially the patient population that's a female patient, a little older. When I say older, not derogatory again, but like that fourth, fifth decade. But one of the tricky things is that what does sympathetic overdrive do? It dries your mouth out, dries your eyes out as protective. So it's that constant challenging. People feel jittery, can make feel like anxiety, but really it's a sympathetic overdrive teasing it out. Same as dryness can make you not make your mouth dry. That could be adrenaline compensation. So it's a challenge to sort out. But we do worry about like that Sjogren's, certain demographics, that neuropathy. It's tricky. That's why the exam is so important sometimes. We always say we want to see doing a good neurologic exam on people. Show is, do we find certain patterns? And those patients will often find when we examine them often have more low blood pressure because they're not
Yep.
squeezing the blood vessels. They drop their blood pressure and they'll come into us and they'll say to us, like, I'm best on medicines like midridine or fludrocortisone. Or you'll know the ones who don't have neuropathy often, they don't respond to midridine and fludrocortisone. They do worse on those medicines. Someone did a project with us and he found that those patients did worse on those medicines who don't have neuropathy. Yeah.
And that leads into, right, same concept when you think about the medications, but another cause would be Ehlers-Danlos syndrome, EDS.
Yes.
I mean, because same concept that you're speaking to, these individuals that they often, EDS patients tend to have a lower blood pressure. They tend to, right, their blood vessels, it's a connective tissue disorder. And so you don't get that blood vessel constriction. And therefore, these individuals can get a lot more blood pooling in the lower extremities, which can, exacerbate lightheadedness, dizziness, and therefore cause the tachycardic response. So they often, that's something we think about. There's the one that we tend to see the most, because there's different subtypes of EDS. The one that I would say in our clinic see the most would be probably hypermobile. Is that what you would feel as well, Rob?
Yes, yes. I mean, I think the thing is, EDS is tricky. I think patients get frustrated. We get frustrated, and a lot of these patients, we look for patterns, right? I think Nicolas is great, double jointed, and it's a term, but a lot of these patients, you'll see these things. They get to their second or third decade of life, and they start developing the autonomic dysautonomia features. And a lot of them have neuropathy because the collagen is misaligned in the nerve tracts. They have low blood pressure. But you start hearing this pattern with a lot of these patients, like, oh, I had joint issues, I had dislocations. You'll hear these unique stories, like I was 25, I had spine surgery, or I had hernia surgery, or I had a lot of bowel issues, or I had gynecologic stuff. You'll hear about these other organ issues that speak of laxity or looseness. And so EDS is there, and I think I become much more, that could be a whole different podcast about this sort of understanding of where we are with EDS, and Ehlers-Danlos as hypermobility, where we are with this, and what it means. There's some data, even with EDS patients, so the females, their pelvics are a little wider, just for the mobility, and that leads to even more of the gut gynecologic issues. Nick, I don't know if you have anything you want to add to some more of these questions, because
Oh,
you're just
yeah,
talking.
for sure. Thank you
We're,
for
we're, we're two chatty guys. We should be called the autonomic dudes. We should be called the chatty Charlies.
no, nah. Okay, so from what I'm hearing, there's definitely like a really big variety of causes that we can pick from, and each of these variety of causes, it's like they have their own unique ways of treating. You have to treat the underlying conditions, and you have to treat the POTS as well at the same time. So a question that I wanted to ask you guys as well is, some patients will delay POTS treatment until they know like exactly what is the cause. And I was wondering, is this really that important? And if so, like, how can we help patients understand this?
Ooh, that's a good one for Kyle. I'm actually punting to Kyle.
Oh boy.
I'm punting to Kyle.
This is definitely a good question. Neurology is a journey. Okay, so first and
Kyle for
foremost,
president.
it is a journey. It's a journey. So oftentimes you're not always going to find that underlying cause right off the get-go. It's not like you're going to come into our first visit, second visit, and you're going to get that answer right away. I've seen people that 2, 3 years in, we eventually find the answer. I've had people that I've seen for 5 years. I still don't know why. It's not that easy. And so if we sit back and we say to ourselves, we're not going to start treating something because we don't know the underlying cause, we could really be hurting ourselves. And I say that with meaning like we could make a lot of progress, right? Without a lot of times without knowing that underlying cause. It doesn't mean we don't look, right? It's not to say that we're not going to try to find that cause, but I think that you have to still start doing the basics and start trying to get this individual to start moving in the right direction from an orthostatic perspective. Because if you wait too long, it's this perpetual cycle, right? And they're just going to continually their symptoms are going to continually worsen. They're not going to get better with us not doing anything. They're probably going to get worse. So I would say jump right in, start orthostatic care, and then throughout, as you continue to follow them and adjusting orthostatic care, then we can continue to deep dive into that potential etiology. But again, I would say don't become stuck. Don't become too stuck on finding that cause. We're gonna look. We're not gonna brush it to the side. We're always gonna look. But we don't want to delay care.
So Kyle, that's a good point. It reminds me of someone I saw recently who got very fixated on their blood pressure, and their blood pressure is going up and down, part of that neurocircuitry. And with that, they actually stopped doing things. They're afraid to do anything. And when you stop doing things physically, and in terms of just living life, what happens to you? The body starts weakening. That compounds the orthostatic autonomic issues. And you stop doing things. I'm talking about even things like doing things that are fun, like go to a restaurant or go to the movies or do whatever you want to do. Then you stop, the joy of life goes away, which makes being healthy or non-healthy miserable in life. It just compounds things. So, this sort of being trapped in a disease or a syndrome becomes like a prison, right? What can you do within your syndrome? I think one of the problems with autonomic, but listen to you is very interesting because it made me think about how the autonomic nervous system's everywhere in your body. It's the glue, it's your eyes, it's your gut, it's your mouth, it's your blood pressure, it's your bladder, it's your sexual function, it's everywhere. So it's overwhelming for a person. It's like, and it's a whole experience. You got to say, okay, I'm going to start at least here, like hydration or get my body moving in this level. And you can get succumbed with something. You got to say, okay, I'm going to start somewhere. It's like starting school. It's like starting a job. You got to start somewhere, some small step. And that's where the causes matter because it could bring your understanding. But in that journey, it's a double edged, it's two roads traveling at once. You got to start somewhere.
Yeah.
Yeah, if I could add on to that really quick.
Yeah, go for it.
Um, just from my experience, like seeing all these patients, I found that they have the same thing in common is that all their lives have been uprooted and they just want to get back to normal. They all just want to get back to normal.
Fair.
But there is one like major differentiator, like you were talking about, getting back on track, getting back to your regular life, to those habits. It's just the mindset that they carry, whether it's positive or negative. It really impacts how they leave the room, whether they leave the room hopeful for the future where they will find a cause and where maybe not even find a cause where they will return to a better life. It really makes all the difference because personally, like I'm not a doctor or anything, but I'm a really big believer in like carrying good energy. And because if you keep on thinking positive thoughts, then those positive circuits in your brain will keep on getting fired and fired and fired. And hopefully that will do something for your body. In college, something that they taught us a lot of times in class was neurons that fire together, wire together. So if you keep on associating your disease with negative thoughts, which is hard not to, it's a very hard condition to live with. But if you at least try and be hopeful about the future, then while you're thinking about that disease or while your condition, then over time, those positive circuits will fire more and more often as you think about your condition.
Yeah. And my little 2 cents on that is, I always say your physical health and your mental health are best friends.
Mm-hmm.
And it's just similar when your best friend is sad, you get sad.
Yeah.
And when your best friend's happy, you're happy. It's the same thing with your physical and mental health. So if your physical health is bad, it can drag down your mental health, right?
Yeah.
If your mental health's bad, it can drag down your physical health. You're right, coming into it with, as hard as it may be, coming into it with an open mind and saying, this isn't what I'm used to. This isn't what I'm used to experiencing, but I'm going to do my best to get back to where I want to be.
Yes,
It's doable. It's possible.
Yeah.
You have to kind of sometimes speak it into existence though.
for sure. It's
But
very
yeah,
important.
It's very sensitive, you guys, too. I think you're talking about someone grieving where they were and knowing where they are. And I think, Nick, you're right. I mean, the body, autonomic physiology is hardwiring, is hard press, hard wiring. It's going to hold on to that very high sympathetic response. It's survival physiology. So the body's not going to let go. So when we say to people like 3 months, 6 months, 9 months, a year, that's hard when someone's 25, 30, 35, 40. They have kids, they're married, they have jobs, there are demands, and you're a young guy. I mean, a year in your life seems forever. So there's a lot of things that are working against people in that regards. But listen to both of you. You know, the one thing is a lot of the work we do is in treatments is getting people from that adrenaline phase that's very locked into that more vagal to get that circuits in that body. So when we talk wellness, I always say this, we're not just saying it because it's big in vogue and fashion, is that we're trying to get those circuits out from sympathetic to more vagal tone. So get vagal, it's not just, we want people to get into vagal, vagal.
Yeah.
The Kyle smiled, yay.
yeah. I think, though, going back to the original question to what are the causes, and kind of going into the history of it all, Nick, I like to, and Rob, I like to ask, I kind of have a yes, no checklist often. When I go through things, neuropathy symptoms, um, head injury history, viral illness in the preceding month, like
Yes,
months leading up to symptom onset. Um, I go into traumatic experiences. Um,
yes,
this can be this can be a controversial conversation. But I go into have you gone through something that was traumatic? Because that body can get stuck in that fight or
yes. The
flight
body
response.
remembers. The
The
body
body
holds on.
remembers. The body remembers. And sometimes it's breaking through that cycle of the traumatic experience. And that in and of itself is a journey, and it's difficult. But I go in, so you'll hear us ask questions like that. And it's because we are looking for that underlying cause. So I think, ruling out autoimmune, if it makes sense
Yes.
from our questions, looking into those other etiologies. It doesn't even, from a viral perspective, it doesn't even have to be COVID. It could be the flu. It could be a GI virus.
Pregnancy, we found pregnancy,
Yep.
any trauma, people have had car accidents. I mean, why? I think you have a point, susceptibility. Why some people post-pregnant versus others? There has to be some susceptibility that we don't know why. Millions of people get COVID and are fine, right?
Yep.
Some people get
Yep.
COVID 4 or 5 times and are fine. Some people never get COVID, right? I mean, it's really is it's wild. And I think you're right about these adverse life events. I mean, it's things we just don't understand. I mean, we did a pilot project and we found just asking patients that people with neurologic diseases like multiple sclerosis, we found Parkinson's, 40%, the general population is 15%, rheumatologic diseases, autoimmune, 40%. These are people who had adverse childhood events, neglect, abandonment, physical abuse, emotional abuse, being with people who you trust didn't take care of you. There's something about people with neurologic and autoimmune diseases, not both together, but it was separate, sends the body in a cascade of something neurologic, autonomic, neuroendocrine inflammatory dysregulation along that lifespan. Doesn't mean you're damaged for good, but this early awareness to catch people, maybe even pediatrics before adulthood might be the future. That's where medicine needs to go. But I think Kyle, you're brave to bring this up. But we'll see people. So I've seen people where in adulthood they got their spouse through a procedure or a health condition or their child, and they get POTS. This dysregulation. But why them versus other people? There has to be something that is going on that renders people susceptible.
Yeah.
Yeah, yeah.
Absolutely.
But I think you're right. Virus, concussion, COVID, is it virus, infections, trauma, physical, life traumas, autoimmune. That's why the autoimmune thing's fascinating because even inflammatory, the autonomic nervous system is immune, endocrine nervous system, and they all tie together and create an inflammatory response. It doesn't always mean that there's autoimmune. It's all getting revved up. That's why a lot of these blood tests sometimes can be falsely positive. It just means everything's revved up. It doesn't mean your body's attacking itself.
For sure. Speaking on to that, we were talking about the COVID and all those different influences and triggers, because it really is like a fire. You just get one little spark and all of a sudden you can get all this. I wanted to ask you guys, what about like before the pandemic? What were the major triggers that you guys saw before the pandemic, before COVID?
Kyle was a trigger.
I was a trigger. Is that what you said?
Big stressful event.
A
I had to kill a humor.
hyper-excitable young man. Yes, I tend to no, I'm just joking. But yeah, I think the similar to what we were just talking about, Nick, I think you know, head injury, traumatic experiences, even viruses before.
Mono.
Yeah.
I've had people who've traveled abroad, gotten some odd illness when they were traveling abroad, and then it kind of wreaked havoc on their body. So I mean, it's not just specific to the pandemic. I think people always there's more light that is shed on autonomic disorders now since COVID, but it's been around a long time. I think Rob alluded to it in the last episode, right? It was first noted after the Civil War. So I think when you really think about that, that's it's been around what's that, Civil War 1860s, so 160 plus years. It's
Yeah,
not
wow.
it's not a new phenomena.
No.
So I think taking that into consideration, um, is key. So I think what I would do is just kind of go down that checklist again. It's not new. COVID brought more light to it, but
Well,
it's not
and also this COVID, you're right, Kyle, because COVID brings more light, and now we're in a sort of phase of hypervigilance. We're finding a lot more things, and it's challenging to sort out what is because we're just more aware and what relevance means. We're seeing some of these blood tests is there just because does it mean something versus something because it's more hypervigilance that COVID has brought to this. Some of the things we're seeing post-COVID is just because we're just seeing things because we're hyper focusing or is it is all long COVID? As there's some of the research we're trying to sort out, but you're right, concussion, viruses, trauma, um, um, the neuropathy will cause a neuropathy. Um, lots of those things are the big things, but patients will say to us, like, why do I need to have neuropathy? Because it might make a difference with treatments, medications, causes. Explaining your body. Many of these patients come to us and they feel like they've never been understood. We're trying to help you be understood. So it's giving you full circle answer back. Almost what you start, Nick, with how these patients have felt.
Yeah. I wanted to add on to that. Just like I was looking online before this podcast, I saw that before the pandemic, before COVID, about 1 to 3 million Americans had POTS. And after COVID actually added about 1 million of those. So it's about 25%. And this is not like a concrete statistic. I just
Yeah.
like internet search. About 1 million people were added after the pandemic to the POTS.
Yeah. And you look at the strain of healthcare system too, right? People left healthcare and hospitals have collapsed. There's a lot of
Yep.
strain, right? And people with chronic health conditions need a lot of care. So it's a strain for healthcare for people to get the healthcare. Yeah.
I know before we kind of explored very briefly like airlos, downlos, neuropathy, and concussions, and I just kind of wanted to ask you guys really quickly, how does airlos, downlos tie into POTS, and does it change anything in specific about how we approach the treatment? If you
You can
guys
go
want.
ahead, Rob. I mean, well, I can jump in and Rob can probably jump in as well. I think so. EDS is a genetic condition. It's not a condition in which, you know, there's a cure. So finding EDS helps you to at least have an understanding of if you were to be diagnosed, okay, at least it makes sense, right? It gives you more of that sense of I have a reason why I have the symptoms I
Yeah,
have,
yeah.
but it doesn't provide a cure, right? It's a lot more, it's similar to POTS. It's a lot of supportive care. It's a lot of things to try to do to improve quality of life and to ensure people get back to the best quality of life they can, as opposed to curing the disease or diagnosis. And so again, when it comes to why it's a connective tissue disorder, it causes the vessels to have difficulty with constriction. The blood will settle into the legs as you stand because of difficulty with the blood vessels squeezing tight to squeeze it back up to the core. So the body, right, if you don't get the blood flow upward, lightheaded, dizzy, and your body naturally is going to put defense mechanisms into place, being that your heart rate will accelerate. And that's why you feel the heart rate as well. So it plays a role in terms of you have a rationale, you have a reason. It's good to know as well. Oftentimes, again, as previously alluded to, we understand treatment options that tend to work better for patients with EDS from a medication standpoint, as opposed to somebody that we don't have any rationale for. They tend to do better with like a medication, like in certain circumstances, based on which we'll get into medications and what's the best medication to use in future episodes potentially, but and why. But midodrine tends to be a good choice for a lot of the EDS patients because it's designed as a vasoconstrictor, right? It tells those vessels, we're forcing those vessels to squeeze down. But again, yeah, that's for a future episode, Nick. We don't want to conquer the world all in one episode,
Yeah, exactly. Well said. But I think you're right. EDS, they, again, building that theme, Nick, and just add what Kyle said, is that the associated things they have to their body, the vascular issues, they often can have very sluggish guts, gut motility disorders, the gynecologic issues. There may be some more autoimmune conditions, platelet abnormalities, bleeding issues. They can have more vascular compression syndromes through their body, through their gut, and even some more awareness. We're learning about some stuff intracranially. So I think it's just like a checklist. Someone said checklist. Who said checklist? Who said checklist?
I think
No,
that
I
was
think Kyle did. Maybe you, Nick, or one of you guys checklist. You're right, just awareness and growing things. I mean, my own knowledge base is, I wish I could go back 20 years to what I said to these patients in the past, but this awareness, acknowledgement, saying this is the things, boom, 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 boom. And they come into appointment and say, okay, this part of the body's going on, knowing I have this mindful space to think about this with them. Because it's very easy to go down a darker road if you're in a room with these patients, if you don't have knowledge about them. You can think something else, which is maybe not always positive or ideal. You just want to know, so these are things that are associated with these syndromes because of the laxity.
Definitely. And we're just about out of time. We have a couple minutes left, but really
You're
quickly.
done with us. You're done with us.
No, it's not that at all. I just want to
Ah,
you guys really quickly, just two questions if you guys have the time to answer it. Just about neuropathy and concussions, even because I know we touched back on
oh,
the very beginning. I was wondering if there's anything you could tell us about that really quickly, if you guys have the time.
ooh, I could say something quickly. I mean, there's fascinating things, more about like fibromyalgia and a lot of what you call head stuff, like brain stuff, that can overexcitatory injury to the nervous system, fibromyalgia, chronic pain syndromes, Parkinson's, for example, that might lead to small fiber neuropathy. So what comes first, chicken or the egg? We're trying to figure that out. That overexcitatory injury may lead to small fiber neuropathy. Those excitatory pathways may lead to small fiber neuropathy. So we used to think like 20% of people with fibromyalgia has small fiber neuropathy. Small fiber neuropathy causes fibromyalgia, but maybe the excitatory pathways of fibromyalgia leads to small fiber neuropathy. Which
Yeah,
comes first, chicken or the egg? That's sort of like big researching. Like, it's exciting. So when you do the testing on these patients are confused. They have a right to be confused because what comes first?
definitely.
I mean, Kyle, you're very into that conversation.
Yeah, I really try to get to the root cause and etiology. I also like, I find it fascinating. Sometimes I can't figure it out. And I love functional medicine. Integrative medicine doctors, they fascinate me. If you want somebody to dig into the root cause of any type of issue, not just POTS, any type of issue, functional medicine, I am jealous of their knowledge base of things
Yes.
that can impact the body. And I want to go see one myself. But but then they might find problems with me I didn't know existed. So I won't do that. But I do truly enjoy them. I think that sometimes I will send patients over that way as well because I find them to be really helpful, really insightful, digging into things that are outside the box, right? Outside of traditional medicine. So Yeah, I think when you think about concussion too, and concussion specifically, things that we think of commonly with concussion: headache, dizziness, mood changes, cognitive deficits. But POTS is a real thing. So I would say, again, you're rattling the nervous system. It's causing an inflammatory state, and when that happens, anything can follow.
Yes. Yeah, that ricochet, that domino effect. I think on that note, it's a good time, right, to wind it up.
Wind down, just get it all over with.
Yeah, I think we have a minute left till we run out of time to save the world. But love you guys. You guys are great for doing this.
Yeah, it
And
was very nice
episode
talking to
two.
you. Yeah,
Oh,
thank
Nick,
you
you
for
make it
having me.
great.
Of course.
Nick's great. Nick is getting us all set up. I mean, I just want to give a little plug. Nick has been an awesome. Summer hasn't even really
Yay.
started. It's June 3rd, so summer hasn't even officially started. A+ summer intern,
Thank
and he's got us set up now on Spotify. If you're listening on Spotify, welcome.
Netflix.
He's going to have us. He's got us
Netflix
set up
too.
on YouTube now. So if you prefer to actually see a face to the voice, you can go on YouTube. And soon to be, we'll be on Apple Podcasts once probably later this evening. So really excited to be on all different platforms. Give us a follow, give us a like, give feedback. We want to see the feedback on the podcast so that we can hear about ways to improve. Also, we'd love to hear about topics that maybe you want to have explored.
Yes.
Because I know there might be a theme and burning questions out there, and we want to make sure that we help out. So definitely give us the like and the feedback, and share it with your friends. We want people to be educated and informed. So we appreciate you guys taking the time to listen to us, putting up with us and our shenanigans, and look forward to kind of continuing the saga of the podcast.
Yes.
Thank you.
Thank you very much for tuning in on Spotify, YouTube, and hopefully soon Apple Music too.
Yay. Thank you.
Good night.
Take
Thank
care.
you.